Hello, a lovely morning to one and all. I am Dr. Safia Jalal, Junior Resident at Sharda Dental Hospital. I hereby now welcome Dr. Swati Sharma ma'am, who is an esteemed professional and head of the Department Public Health Dentistry at Sharda Dental Hospital. She holds a work experience of 13 and a half years. She is a highly accomplished individual with multiple articles published, both national and international. She also holds one grant patent under her name. With her commitment towards Sharda Dental Hospital, she has organized an estimate of thousands of mass oral health programs. She has exceptional leadership skills and instant decision-making skills even under stressful and high-demanding situations. She inculcates the management skills, leadership qualities, and creativity to perfection into the students. She ensures the growth and development of public health dentistry department along with the teaching and the non-teaching staff as well. She has the zeal of promoting oral health awareness to various communities via e-camps, via e-sessions, via camps, via social media platforms, and counseling session and one-on-one interaction. We are so honored to have you here today, ma'am. Welcome to our Facebook Live session on the occasion of Public Health Dentistry Week from 19th to 25th of June.
Thank you, Safia. Thank you so much, and good morning to all my audience.
So without any further ado, let's begin with the session. So the first question that we have coming up for you is, what is Public Health Dentistry Day?
Well, Safia, Public Health Dentistry Day is one of its kind in the world because it is dedicated to all the dental public health professionals all over the world, who are working tirelessly and they are striving hard for the oral health promotion and the prevention of oral disease across the nation and across the globe to have a healthier world. So yes, it is unique because it is organized by our Indian Association of Public Health Dentistry, which is one of its kind. It is one of the biggest organization in the world, and it has 2,200 dental public health professionals, and nowhere in the world we have such a big organization which has so many public health dentists. So I am honored to be a part of this team.
Ma'am, would you please like to throw some light on who actually are public health dentists?
Well, Safia, public health dentists are trained dental health professionals who are trained to go to the camp settings bearing all the challenges, and there are so many challenges of on-field camp settings, but we are trained and we deal in the oral disease in a community level. हमारा जो रोल होता है वो एक इंडिविजुअल को खाली एक इंडिविजुअल को ठीक करने का नहीं होता. हम कम्युनिटीज़ में जाते हैं, डिफरेंट कम्युनिटीज़ में जाते हैं, चाहे वो स्कूल्स हैं, कॉलेजेस हैं, अर्बन लोकेल्स हैं, रूरल लोकेल्स हैं, हम सब जगह जाते हैं और सबको इकट्ठा लेकर सबकी मुंह की दांतों की सेहत का ध्यान रखते हुए हम साथ में उनको लेकर चलते हैं. And if I talk about the scenario in our country,
Yes, ma'am.
As we all know, we have a huge population and there is a massive unmet dental treatment needs. So in such a country, I am a little sorry to say on this platform, but yes, the awareness level and the approach to basically availing the dental services, they're very laid back.
Yes,
if I talk about the rural areas, the approach is laid back because the awareness is not up to the mark.
Yes,
and if I talk about the urban and the peri-urban locales, the awareness is there, but due to the fast life pattern, they don't have the time to avail the dental care till the time the pain actually happens to them.
Yes, ma'am.
So here the role of a public health dentist plays a very important role. We play a very vital role in bridging those gaps, connecting with communities and spreading the smiles. And there are so many sections of society which are untouched. So basically, हमारा main role होता है to provide affordable dental care to inaccessible groups of society.
Yes, ma'am. That is a really nice motive to promote oral health awareness. Next question that we have is coming up from Jayati, and she asks, what is an outreach program?
Okay, so the answer to this is an outreach program, as the name itself indicates, and it is an oral health program which is meant for those who are unreachable, an outreach that is within, not in the reach. So it is customarily made for those sections of society where either the healthcare is not available in their close vicinity or they can't afford it. So they are customarily specifically designed for those sections of society.
Ma'am, in your 13 years of experience, can you please name a few outreach programs that has been done under your supervision?
Yes, I am glad enough, and with the assistance and the help from the Sharda Dental Hospital and the management, we have got a good armamentarium so that we can conduct those oral outreach programs. To name a few, we have done one of its kind in the COVID pandemic times. We have done an 𝐒𝐞𝐚𝐥 oral health program.
Yes, ma'am.
During which, COVID pandemic time, as we all know, we all have faced, neither it was possible for the masses to reach out to us, and neither it was actually possible for us to reach the masses. So, so that in a way the dental needs are not, they are not affected. So we conducted one of its kind, an 𝐒𝐞𝐚𝐥 program. And in this special 𝐒𝐞𝐚𝐥 program, we connected with the, the communities, not in just the 𝐺𝐵 district, but we have connected with the communities of various states of Maharashtra and Rajasthan, and even in adjoining nations of Nepal and Bhutan as well. So this was one of its kind, and we have tried to spread our word and across the nation also. And apart from that, we have done one of the outreach program for LGBTQ and female sex workers community, which is definitely due to different social barriers, they are not comfortable and they don't avail the oral health care. So we try to connect with them. And last year, I remember हमने उन स्कूल के बच्चों के लिए जो कि प्राथमिक और माध्यमिक शिक्षा प्राप्त कर रहे हैं, जो सरकारी स्कूलों में बच्चे हैं यहाँ पर 𝐺𝐵 डिस्ट्रिक्ट में, हमने उनके साथ ब्लॉक एजुकेशन ऑफिसर्स की मदद से हमने एक डेंटल प्रोग्राम किया था जिसका नाम था मुस्कान है दान सदा के लिए. So these are the names of, few of the oral health program.
Ma'am, that is truly an incredible milestone that you have achieved. Let's move on to our next question. We have coming up from Nishu, and she is asking, what are the greatest challenges that you and your team faces in a camp setting?
Well, Safiya, as all the fields are, bound by challenges, so are we. We are not less. And one of the biggest challenge which me and my team as public health professionals we face is we have to travel lot of kilometers to reach the camp site. And it's not just about reaching the kilometers. After reaching those kilometers, we have to be very prompt decision makers, and we have to deliver the dental care, to them. So we have to have the same zeal and enthusiasm and the energy.
Yes, ma'am.
Even after traveling those kilometers. That is not an excuse for any of us being a public health professional. And secondly, I'll say that we have to bear all the temperature variations.
Yes, ma'am.
Whether it is a scorching heat, or it is chilly winters, or it is heavy rainfall. We cannot afford to stop in delivering our dental care.
Yes, ma'am.
So these are few of the challenges, but not the entire list.
Yes, ma'am. Ma'am, have you ever experienced any medical emergency in the camp field setting?
Yeah, well, Safiya, this is a very important pointer you have pointed over here.
Yes, ma'am.
Handling a medical emergency at a camp setting is definitely a very big challenge in handling a medical emergency in an apex hospital setting. Though me and my team, we are all trained well, and we have all the armamentarium which are needed for handling a medical emergency in a camp setting. But we as a public health professionals, we have to be very prompt decision makers regarding the treatment plan for the patients at the camp settings. So we do take care, and till now we are able to handle them, I can say.
Yes, ma'am. One must require great skills and great spontaneity and manageable skills to handle such situation at a camp setting. So moving forward, as I can see, our viewers are all ears and they want to know, where do you actually provide them with the treatment?
Oh, that's an interesting question actually. We provide them the dental treatment in a state-of-the-art mobile dental van, and it is a vehicle which is meant to go in the remote areas, and it is a mobile dental van, that is, it is mobile, we can take it anywhere, and it is fully, it has all the functional armamentarium of what is there in a basic dental setup. We have all in that mobile dental van, and it goes door to door, places to places, and that is how we we provide them the dental care at the remotest areas.
Yes, ma'am, that is an asset to the department.
Yes.
Ma'am, as you have mentioned about the outreach program, are they really helping the public in any way?
Yes, definitely. Those sections of society where they are being exposed to the oral outreach program, they are definitely benefited. And that we can say that they are well versed about the occurrence and the pattern of the oral disease. They are more aware, they'll be more prompt regarding availing the dental care than with a group of people who are not been exposed to any oral outreach program. So they are definitely benefited. Yes,
that is actually true, ma'am. People don't usually take care of their oral health until and unless they are told about to. Let's take up another question. Rahul asks, do we have any difference in the type of awareness program locality-wise?
Yes, the awareness campaigns which looks so maybe a simple to any layman that okay, awareness ही तो करना है, campaign लगाना है, just you have the crowd and we can have it. It's not that simple. First of all, we need to have an eye that which is the target group where we have to conduct an awareness campaign. Is it an urban locale or a rural or a school or any company? What are the kind of people? Because the main motto of these awareness campaigns is to connect with the communities at large.
Yes,
so in rural areas, if we have to conduct, then rallies and nukkad natak will be better off. And in urban locales, it would be cyclothons or marathons, because you can imagine if a rally happens, then in an urban locale, the people would be really annoyed.
Yes,
so in schools, our campaigns will go with something known as role plays or dramas. So it depends upon, the campaigns depends upon the community, because we have to ultimately connect with the community to have an effect on them.
Yes. Next question, Pema wants to know, what are the resources and the manpower required to execute a successful dental camp?
Well, we require a huge resources and manpower. But if I start with on a very basic layout, if we are, we need a team of trained public health professionals, first of all, JRs, then we have paramedical personals, then we have attenders, mobile van drivers. If a target group is of maybe 100 or more, then we require a team of 10. And then it goes beyond, if the target group it increases, then we have to increase our group. If it's a big campaign, then sometimes we have to take a big team of 30 to 50 doctors and personals also. So it depends upon how big the event is, how big we have to target.
Ma'am, we appreciate your initiative to arrange such a great team to execute a very successful camp. We have next question. What are the positive feedback, or do you see any positive impact after consecutive camp at a specific location?
Okay, so we are fortunate enough. If I talk about the feedback, so wherever we are conducting the camps, we have been called there again. First, I think this is a very good feedback what we get, because I am here in the Sharda Dental Hospital now, past 10 years plus. So yes, wherever we go, we have been called there again for conducting the subsequent camps. One is that feedback. And the other one is, if we see the baseline assessment and then we assess the data of how much oral disease were there in the past. So जब हम वहाँ पर सेम लोकेल पे फिर से जाते हैं और जब उनका डेटा हम फिर से लेते हैं, then when we compare the data of the earlier 5-year data and now, so there is a reduction. Yes, there is a reduction and there is an improvement in the awareness level of the people.
Definitely.
So I think this is how it goes.
This is a huge success in itself. Okay, ma'am, how do you spread the word or the knowledge into the village that camp is to be organized on so and so date?
Okay, so Safia, basically for this particular purpose, we have a PRO with us, and we believe in, we are all the public health professionals, we are doctors. So if we have to connect with any community, we have to connect with their community leaders, which varies. If we have to conduct a camp in a village, then the community leader would be a pradhan, then a pradhanacharya in a school, or the authorities, in case of if we have to maybe involve all the schools or the authorities at the district level, depending upon which is the target community. Yes. So accordingly, we try to approach those leaders. We try to have a faith and try to connect with those leaders. And so the initial part we do it like this, and then our PRO take it forward and go do door-to-door campaigning also.
Yes, ma'am. Since we have so many questions, we can take up one last question asked by Nishu. She asks, do you feel that these camps or the outreach program would change the inner voice of the nation?
Yes, definitely. All these public health programs, they definitely change the inner voice of the nation, because the framework which is there in these oral outreach or any other public health program, it goes from local authorities to district level, district to state, and then state to nation. So this is how we are connecting the masses, we are connecting the populations, we are taking all together. And if we have a healthier young adults, then we'll have a healthier adults and a happy nation and a better smiling and a healthy adult. So this is how I think it goes. Yes, it will definitely affect the voice of nation.
Amazing, ma'am. Amazing, great words of intellect has been imparted in a very easy language. Hopefully, we are making the change for a good and a better world, spreading smiles, connecting communities. And to conclude, I must say it was a very informative and valuable learning experience for all of us. Thank you so much, ma'am, for taking out your time and talking to us. Would you like to give any message to the viewers or?
Well, just one line I like to say to my viewers in the local language: Swasth raho, mast raho, khush raho.